Okay, so that is the end of our presenters now. I'm just assuming that something came up within the facility, the Living Center, where Michael Wemple is the CEO. And as you all know, as employers, that is something that is pretty challenging on a regular basis of being able to attend meetings when something comes up at your facility. And it's one of the reasons why we really developed one of our communication strategies of getting input from you all as employers through our SurveyMonkey rapid response surveys, because we realized that having you attend curriculum meetings or training, trying to develop educational training around the state is just something that doesn't always work for you. So again, we're working really hard to try to be innovative and creative about how we set up these communication processes, and we will continue to do that even after Healthcare Montana implementation dollars are gone. So Carol, we want to jump back to you again.
Sure. So if you want to go to the next slide, we're going to give you an overview of a document that we've created. As Kay said, as part of sustainability, we're leaving a lot of this stuff just isn't going to stop when the money goes away. We've got a plan in place, and many of these things are just are going to be available online and easily accessible. So we want to just spend a little time talking about a resource guide that we've created. This will be located at this address, this web address, www.healthcaremontana.org. And I think with that, Kay, we can go right to the document.
Okay, there you go.
All right, so Kay's just going to scroll down for me here. We're going to just take a minute. So this is, imagine if you will, that this is a web page. Just a little overview. And just to reiterate that these programs and materials were created with employer input and in response to needs, expressed needs. So the first set of programs that we're leaving for free use are the success skills. These are hot links on this document. So you'll be able to click here and go right to the package of materials. It's 5 minutes. It'll have the videos. Everything will be all available for you. These were designed to help CNAs and other staff with specific success skills. And then we spent time talking about LEAD. We're not going to go to these because that would just eat up way too much time. But so all of the LEAD materials are available here. Then we also have the CNA Specialty Restorative Care. It's an 80-hour course. That's also free, and you can access that by clicking here, clicking on the link. It can lead to a national certification in restorative care. Then we have several college credit programs that were developed. So these are, we classified these as degree programs. So the PN distance program. This program changed from 4 semesters to 3. You can read all of this, the number of credits. It's a hybrid. It's offered at 3 campuses. We're providing links. These will take you directly to these programs at each of these campuses, and a short description of what is available at each campus. So moving on, Associate of Science in Nursing. This changed from 6 semesters to 5 semesters. It's often offered on campus at 10 Montana colleges, and there is the list. Again, those will take you directly to that program page. And then moving on, BSN Distance Completion. This program changed from multiple curriculums to a 3-semester, 48-credit common curriculum program. It's offered fully online, but then the 2 clinical credits can be completed at a healthcare facility in the students' home communities. We've got those campuses listed. And then we're moving in, and somebody asked about the behavioral health and the fundamentals. So we actually have this is a degree program. We actually have 2 different behavioral health I don't want to call them courses. I'll call this is a study, and the other one is a program. So this is a college credit program that was created through Healthcare Montana and is offered at Highlands College in Montana Tech. And that is going to be, actually registration for that will start this spring for the fall semester. And this is a 15 credit course, and it does include the MOAB training, which is the management of aggressive behavior. So that's a 1 semester program, and there is funding available. We will eventually have a link. They're not ready to, they don't have all of the details worked out on this funding, but soon. And when that is, it will hot link right to the scholarship information. So there's been a very dedicated group of people that are working on career essentials for health sciences, 5 3-hour online self-paced modules that are completed by students entering allied health. So it helps with that laddering and latticing. If they are not quite sure they want to be a surge tech or whatever, you know, they can float around. But at least they'll get this core curriculum, which was developed by Healthcare Montana, and lots of campus and employers worked on those committees. And so and we're just gonna breeze through this as part of work with Montana, our Healthcare Montana, the consortium colleges each worked on at least one project, and you can see that several did way more than one. So we just provided a list of some of the new or enhanced programs that were created around the state over the last 3 years. Then the continuing education, so the first one is that fundamental. So this is an add-on course, and this would be, for example, an ER nurse. It could be, we have some paramedics that are taking the management of aggressive behavior training. It's really for somebody who works in maybe a clinic where you see a lot of challenging situations with folks with mental health disorders. And so this will be online starting in April 2018. And then there will also be scholarship funding for that. The community health worker was developed sort of as a sidebar in conjunction with the Montana Office of Rural Health, AHEC. And so that is, that course will be available online starting March 2018. I was one of the beta testers of this course, and it's so comprehensive. It is a really good course, and they're working hard to make it very, very user-friendly. So that's, and then we have some CNA distance learning, and I'm not going to read all that, but then if you scroll down, these courses are available through the Montana Hospital Association, Montana Health Network, and Miles Community College. And again, those links will take you right to those programs. Here's a link. Sandy Sacre just talked about the clinical resource registered nurse training. And so this link will take you to their information and registration page. And again, that's been very popular. So moving on then to healthcare apprentices, we heard a number of our speakers talk about apprenticeships that were developed at their organizations. At the outset, there were no registered healthcare apprentices in Montana. Today, there are more than 160, as we said earlier. And so we've got a lot of detailed information at the Healthcare Montana website. Apprenticeship, this will take you to the apprenticeship section. And it has all kinds of materials as far as consent forms, you know, just all kinds of information to get you down that path of creating an apprenticeship. However, the best thing to do would be to contact, there will be apprenticeship specialists that will continue on at the Department of Labor, and you can reach them at this contact information, with this contact information. So here's a list of the apprenticeships currently available. And then moving on, we have the 3 that I just mentioned: behavioral health technician, community health worker, and the fundamentals. Those will all be available as apprenticeships as well. Just some partners that will carry on some of the work that was started by Healthcare Montana. There's been a Montana University System Healthcare Education Workforce Coordinating Council, and I always say they should really need to shorten that name, was created, I'm thinking maybe a year, maybe a little longer ago. and they're charged with the following actions, and they will they'll use the healthcare workforce strategic plan that was developed as under the auspices of Healthcare Montana. So they are relying on that document as their foundation for work plan and prioritizing and strategizing.